Today, in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon Se, Samvad Sarokar News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topic. And today, our topic is a very, very current and relevant, and that is best vaccine for COVID. But before I will go for the main topic, I would like to inform that today India is celebrating Guru Gobind Singh Ji's Jayanti. The birth anniversary of Guru Gobind Singh, the 10th Sikh Guru, is celebrated as the Guru Gobind Jayanti. Born Govind Rai, Guru Gobind Singh was formally installed as the leader of the Sikhs at the age of 9, becoming the 10th and final human Sikh Guru. Guru Gobind Singh was a spiritual master, warrior, poet, and philosopher. Among his notable contributions to Sikhism are founding the Sikh warrior community called Khalsa in 1699 and introducing the 5 Ks, the 5 articles of faith that Khalsa Sikhs wear at all times. Guru Gobind Singh is credited with the Dasam Granth, whose hymns are scared part of 6 prayers and Khalsa rituals. He is also credited as the one who finalized and enshrined the Guru Granth Sahib as Sikhism primary scripture and eternal Guru. Media conference with Lal Goel wishes you all a very, very happy Guru Gobind Singh Jayanti. Now coming to our main topic, and that is best vaccine for COVID. I would like to inform that till yesterday, India is having total confirmed cases of COVID 1,05,96,228. And yesterday, addition was 13,581, while the total mortality yesterday was 154. A COVID-19 vaccine is a vaccine intended to provide acquired immunity against COVID-19. The worldwide endeavor to create a safe and effective COVID-19 vaccine is bringing fruit. A handful of vaccines now have been authorized around the globe. Many more remain in development. By January 2021, 69 vaccines candidates were in clinical research, including 43 in phase 1 and 2 trials and 26 in phase 2 and 3 trials. In phase 3 trials, several COVID-19 vaccines demonstrated efficacy as high as 95% in preventing symptomatic COVID-19 infections. As of January 2021, 9 vaccines have been authorized by at least one national regulatory authority for public use. 2 RNA vaccines, the Pfizer-BioNTech vaccine and the Moderna vaccine. 3 conventional inactivated vaccines, BBIBP, COR-V from Sinopharm, BBV152 from Bharat Biotech, and CoronaVac from Sinovac. 2 viral vectors vaccines, Sputnik 5 from the Gamaleya Research Institute and the Oxford AstraZeneca vaccine, and 1 peptide vaccine, Epivac Corona. Johnson & Johnson's COVID vaccine could be a game changer. If J&J phase 3 trial report very strong efficacy, it will be the single shot vaccine that can be stored and transported at refrigerator temperature, unlike Pfizer and Moderna. India gave approval to 2 vaccines, Covishield of Serum Institute of India and Covaxin of Bharat Biotech. Indian vaccination program was launched by Honorable Prime Minister Mr. Modi on 16th January. As of 14th January 2021, 32.64 million doses of COVID-19 vaccine had been administered worldwide based on official reports from national health agencies. Till yesterday, 4,54,049 people have been vaccinated in India. The country reported 580 severe events and 2 persons, a 52 years old in Moradabad and a 42 years old in Karnataka, have reportedly died due to cardiopulmonary disease after getting their shots. Now, vaccine manufacturers Serum Institute of India, SII, and Bharat Biotech came out with the fact sheets. individuals who cannot receive the vaccine, as far as the Covishield is concerned, who had a severe allergic reaction after a previous dose of this vaccine, or had a severe allergic reaction to a ingredient of this vaccine. While Covaxins, according to them, have an history of allergies, they can't take the vaccine, have fever, have a bleeding disorder, or are on a blood thinner, are immune compromised, or are on a medicine that affects your immune system, are pregnant, are breastfeeding, have received another COVID-19 vaccine, any other serious health-related issues as determined by the vaccinator or officer supervising vaccination. Now, to discuss this very, very important point, which is nowadays having everyone in India, I will say rather in the world, is thinking which vaccine is the best, where we have to take, which one we have to take. Although in India right now, because of the government regulation, initially the vaccine is to be given only to frontline warriors like medical, police, army, etc. And for them, it is a free of cost, and it will be, there is no choice of them which vaccine they can choose. Only thing is, their choice is whether they would like to take vaccine or not. So to discuss which the best vaccine for corona or COVID, we have a very, very elite, educated authority in the medical field who are going to give their expert opinions about the topic. And I would like to invite my first guest, and he is Dr. Om Srivastav. Dr. Om Srivastav is the Director of Infectious Diseases at Jaslok Hospital, Mumbai. He is the member of COVID Task Force, Government of Maharashtra. He is the visiting professor, Infectious Diseases, D.Y. Patil University Hospital, Navigation, Mumbai. He is the unit head of Kasturba Hospital for Communicable Diseases, Mumbai. Dr. Om Srivastav had completed his training in MD Medicine from India. He then commenced his training in Sydney, Australia, where he trained at St. Vincent's Hospital, Liverpool Hospital, and Royal North Shore Hospital. He also serves as member of State Advisory Committee H1N1, State Malaria Death Review Committee, Dengue Death Review Committee, Swine Flu Death Review Committee, and Maharashtra Communicable Diseases Prevention and Control Technical Committee, MCDPCTC. Welcome, Dr. Om Srivastav, on our show. Dr. Srivastav, my first question to you is, have you received vaccine shot? Yes or no?
So thank you for your kind words of introduction, generous introduction. Answer to your question is yes, I have received.
Okay. When you have received, where your family members asked you or anyone of your well-wisher asked you to delay it or avoid it or not?
Well, that is something that is ongoing right now. There are always people who've got their own perceptions about the advantages, disadvantages, delaying it. The only thing that was on my mind was, it's not like it's a tablet of paracetamol that if your headache is not better, then you can take another tablet. Once you've taken one vaccine, then you are committed to the cycle of that vaccine to your immune system for the next 1 year's time, at least 1 year's time, if not longer. So that was the only question in my mind as to whether or not I should delay it or not. But look, I think it's worthwhile with the evidence that's available, with the vaccine that is being first commissioned. The evidence that is available, I think it is pretty robust, and I was quite happy to take it.
And may I ask you which vaccine you have taken?
I took the Bharat Biotech vaccine.
Bharat Biotech.
I've seen their data more closely. I'm aware of the data. I was closely involved in their phase two trials, and I thought that vaccine was at this time probably the best one available.
Okay. Thank you very much, Dr. Om Srivastav. I will come back to you. Now, I would like to invite my next guest, and he is Dr. Brahm Prakash. Dr. Brahm Prakash is the former medical superintendent, All India Institute of Medical Sciences at Rishikesh. He did his MBBS in 1977 from King George Medical College, Lucknow. He did MD Pediatrics in 1995 from SN Medical College, Agra. PG Diploma, PG Dip HM in, I'm sure it is PG Diploma Hospital Management in 1997 from University of New England, Emmerdale, NSW, Australia. Strategic Management in 2014 from ISB Hyderabad. He did PhD Medicine in 2001 from Bundelkhand University. He also did International Observership in 2019 from Harvard Medical School, Teaching Hospital Boston and Children's Hospital Boston, USA. His specialization is in pediatric neurology and hospital administration. He has written several books and his research papers published in reputed national and international journals. Welcome, Dr. Brahm Prakash, on our show.
Thank you very much, Mr. Lal, for generous introduction. Thank you very much.
Dr. Brahm Prakash, my first question is, have you received vaccine shot?
Not yet, not yet.
Not yet.
If I'm waiting for my number, actually. I'm eager to get it. I'm eager to get it.
So if you will get a call immediately, you will go for that?
Yeah, I will go for it.
Would you like to choose whether you would like to go for which, the Serum Institute or the Bharat?
I have gone through the data for both the vaccines. And both the vaccines are good. And I'm being a pediatrician. Any public health emergency can be tackled effectively by vaccination. What we have seen pulse polio, what we've seen in smallpox, measles. Because being a pediatrician, I have been involved with pulse polio immunization, all the immunization for the children. I got my firm belief in vaccination.
So you have no problem if you will get any of the two.
Any of the vaccine. I have gone through the data I've gone through the Lancet, data is available for AstraZeneca. Data is available for other vaccines also. Bharat Biotech data also I have gone through second trial. But now in India, almost 4 lakh people have been given the first dose. Until now, if we see, there's not much after effect of any vaccine to anybody. There may be something happened in Muradabad, but the person was having, the pus in the lungs and, other things also. It may be a coincidence. That may not be cause of
Okay. Thank you, doctor. Now I would like to invite my next guest, and she is Professor Dr. Amita Jain. Professor Dr. Amita Jain is MD, PhD, FRC, Path, FAMS. She is the Professor and Head Department of Microbiology, King George Medical University, KGMU, Lucknow. She is the Nodal Officer for Laboratory Technical Support in COVID Testing for Uttar Pradesh. She is the in charge of COVID Testing Lab, KGMU. She is the member of National Tuberculosis Expert Group. She is the member of Subject Expert Committee, Antimicrobials, MOHF, that is Ministry of Health and Family Welfare, Government of India. She is the chairman of Institutional Biosafety Committee of KGMU. She is the member research committee, SGP, GIMS and RML, PGIMS, Lucknow. She is also member of IEC, KGMU, Lucknow. Her research interest is in tuberculosis and virology. She is having 8 Indian patents and PTC. She has published 286 papers. Welcome, Professor Dr. Amita Jain on our show.
Thank you, sir.
My first question to you is same. Have you got your vaccine shot or not?
No, thank you first for your very, very kind words. I'm really honored. I did not receive the vaccine yet. Reason being, the list which was provided to my institute did not include my name. Am I keen on it? Yes, I'm keen on it. I'm already, I have suffered from COVID and I had moderate illness. So I've gone through it. I've tested my antibodies. They still exist. So if my name comes later in the list, that's okay. However, I'm very, very keen on it. I really want to get
And would you like to choose which one you want to go, or any vaccine whichever is available at that time?
Anyone is okay, because anyone is okay with me, because I understand, being a microbiologist, I understand that what are the types of antibodies which should be formed, and I think both
will be okay.
Both of them can form that antibodies. So any type is okay with me. Right.
Okay, thank you very much, Dr. Jain. Now I would like to introduce my next guest. He is Dr. Kapil Rathi. Dr. Kapil Rathi is the medical director and consultant of My Health Clinics, Mumbai. He is consultant physician and COVID physician working as a frontline warrior in this pandemic. He is MBBS, MD medicine and diploma in chest medicine. He also did diploma in infectious disease. He has been actively involved in COVID management of patients and taken almost more than 50 CME on COVID in last 6 months for various organizations. Welcome, Dr. Rathi, on our show. Dr. Rathi, my first question to you is the same. Have you received your vaccine shot or not?
Thank you, Mr. Goel, for inviting me to answer your question. I've still not received. Maybe in a couple of days, I'll be on the radar for vaccine. So in a couple of days, I will get a shot of COVID vaccine. Yeah.
And you will go immediately for that?
Oh, yes, 100%. Being a frontline warrior and seeing the patient so closely and treating more than probably 1,500 plus patient of COVID, I can see how devastating the disease is. So probably everyone should go for vaccine, whichever is available to us.
And any choice of the vaccine or not?
Probably both are same, to best of my knowledge, to best of the data what is available, and it doesn't matter much. What matter most of this is that we should take a vaccine. That is most important, rather than to choose between either of those.
Okay. Thank you very much. Now, Dr. Srivastava, my question to you is, which vaccine will be more effective in treating COVID mutants in future? Covaxin, Covishield, or vaccine based on mRNA, that is Pfizer or Moderna? Dr. Srivastava, please.
So that question is, I think it's a little bit premature. I'll tell you why. Because if you look at the number of mutations that we are seeing with the vaccine, with the virus, with the COVID-19 virus, there are several mutations, small ones, large ones. Which one of these mutations is going to be having a clinical impact? We don't know. We're not sure. Some of them may not be even relevant. They may be redundant. Some of them may be very significant, and that they may actually alter the efficacy of the vaccine. So, as we prepare, as of today, with the information available, the vaccine that is available right now will cover all the mutations that have come forth up until today. But then tomorrow might be a fresh day. Tomorrow might be a new set of mutations. So the vaccine will have to be, the next generation of vaccine will have to be, in a position where they can modify the structure that will cover these mutations. Now, the names that you have taken are interesting, because a number of these companies are actually working on expanding the total amount of coverage that will come out of the vaccination. The Johnson & Johnson, the Moderna, the other vaccines, they are looking at expanding. But if you were to simply look at between, say, December of 2019 up until January, up until last 2 days ago, there have been more than 1,700 mutations, of which only about 350 or 360, 370 are considered to be significant. But that's 360 significant mutations of the primary genomic structure of the virus. So I think it's a question that we'll probably have to answer as we go along. Once we know that the virus is no longer going to be having the kind of mutations that will be clinically significant, or at least will slow down, then the vaccine production may be able to involve all those variants so that it may be more effective. So maybe the next generation or the third generation or fourth generation of these vaccines that are being produced, or the vaccines that may be available by the time it comes to, say, June or July or August of this year, they may be able to offer a much bigger efficacy than what is being offered right now. This is my perception. I'm not saying that is exactly how it's going to happen, but that is where the scientific evidence is leading into.
Okay, thank you, Dr. Srivastava. Professor Dr. Brahmprakash, would you like to add anything, or you would like to have comment on this particular what Dr. Srivastava?
Yeah, if we see the flu vaccine, every year a new batch is coming, for variants. And this variant is in every virus. But as far as at present, I think we have got the best possible vaccines for this, and variant we must be able to check this variant also.
No, but Dr. Brahmprakash, as far my knowledge is concerned, the flu vaccine, every year you require a new shot because of the variants. But
Yes.
whether this vaccine will continue, because as Dr. Srivastav said, and the data which are showing right now that this vaccine maximum limit is right now one year, maybe that it may go beyond that. So do you think that again we have to go next year again for a new shot with a different vaccine?
I think this corona is going to be endemic, and we have to modify the vaccine accordingly every year. I think so.
Okay. Dr. Jain, what you say about this? Please unmute yourself. Please unmute.
See, I agree with Dr. Om Srivastav. This question is slightly premature. Coronavirus is a more stable virus than influenza virus. We really do not know for how long this immunity is going to last. Will it last for, because all the vaccines have a shelf life. Even the immunity which is induced against that has a shelf life. So if I develop antibodies, I do not know how long these antibodies are going to last. If it lasts for more than a year, why do I need a shot really? So the type of antibodies we need are actually neutralizing antibodies. So if you look at all these 300 some mutations which Dr. Om has mentioned, I think 11 of them are in that region where we should be worried about. That S gene against which we are targeting because they will be neutralizing antibodies. And on that S gene, around 11 mutations are mutations of concern still now. So the protein which is formed, antibodies against that will probably be working against this variant of concern 1 and 2, about which we are worried about that UK strain. However, we do not know how virus will change itself. Considering that it's a more stable virus than the flu virus, and the antibodies may last for maybe more than a year, we may not need a new vaccine right now. But in future, we will have to keep a watch. We'll have to keep watching the nature of the virus, the way it changes, and have to change the vaccine accordingly, which will not be very, very difficult. Because once you have learned the trick how to prepare that, only thing you have to change is the target. So the virus will be replaced or the protein will be replaced and new vaccine will be ready. So we'll have to constantly keep a watch, number one. Number two, we'll have to keep on making the changes in the vaccine, the newer vaccine, hoping from here that probably this vaccine will be good enough for a year or two. So that's my comment.
Oh, okay. Thank you, Dr. Jain. Dr. Rathi, same question to you, or you would like to add anything, or you would like, what you want to say about this?
I think what all have discussed, I think that's more relevant. So I think again, as Dr. Srivastava has pointed out, it is too premature to talk about variants and everything. First thing is that we should vaccinate a maximum number of people. I think that is the most important, so that your disease doesn't become a pandemic. It goes to a stage where we can control it. Number two is that, yes, now this platform on which the vaccines have been made, now they have got such a technique that we can change the whole entire genome sequencing and everything within 3 months. So probably within 6 months, we can be ready with a new vaccine, which might be the problem at that point in time. So yes, we are, I think probably all pharma have anticipated that, and probably they are ready for that also. The good thing about this variant are they're only more infectious, they're more transmissible. They doesn't produce much sicker disease, or they have not more killer disease. So probably right now, the way forward is to give vaccine to more number of people, to vaccinize whole of the globe as soon as possible, and probably keep a very close watch on mutation. And probably after a year, as we all think that probably we might need a booster after a year, maybe the newer one will be the right booster to give after a year, because it will last for a year, at least antibody will last for a year. That is my take on this.
Okay, thank you, Dr. Rathi. And as you mentioned that we must try to vaccinate maximum people. Now, I will give some figures. In India, 55 crores population is below 18 years. That is out of the purview of the vaccination. Approximately 6.75 crores are pregnant women in every year. That is again out. About 3.35 crores breastfeeding mothers are there. They are also out. About 65 crores are out from the about 135 crores population. So the balance is 70 crores. Now, Dr. Srivastav, if we are going to vaccinate all of them, how many years? In last 4 days, about 4 lakh something vaccination has taken place. That is about a lakh per day. So for 70 crores, how many years we have to go for the vaccination? Dr. Srivastav, please.
That's a very good question. But I think that you probably need to look at the glass half full rather than half empty. I think the people who are going to be the maximal at risk will need to be prioritized. That means, of course, healthcare workers, of course, defense personnel, police people, that set of people. Also, people who are in high risk categories, medically, otherwise. So transplants right now are not being vaccinated because we don't have enough information. Those people who are at likeliest chance of getting into a complication will need to be given the priority. Now, you may decline it as a healthcare worker. You may decline it and say, no, I don't want it right now. But that is going to be more an exception than the rule. But for the vast majority otherwise, they will need to be vaccinated. So even if it is 5 lakh people per day, a lakh of people per day is no real achievement. Most teaching hospitals will be able to have a booth that will be able to vaccinate 3,000 people a day. One booth can be able to accomplish that. A major teaching hospital like KM Hospital in Mumbai can do that. I'm sure KGMC Lucknow or All India Institute, Rishikesh, or other such major institutes, you probably don't need a big infrastructure. You probably just need a booth with 4 or 5 healthcare workers who know how to give an injection, and that should be able to look after at least 3 to 5,000 people a day. 5 such booths will look after 10,000 people. So 1 lakh is too little a figure. So you prioritize those people who need to be given the vaccine first. You get them out of the way first. And then, as Dr. Rathi has pointed out, you need to vaccinate as many people as quickly as possible. Now, that might take a few weeks, a few months, and that might be maybe a logistical challenge, not a nightmare, but a challenge. But it can be done. It is doable, because unless you do that, you will find that you are going to be keeping vaccinating everybody till the end of 2022. So you've got to be looking at, of the numbers that you have mentioned, Mr. Goel, which of these numbers are going to be at the maximal risk, which ones need to be prioritized, which ones need to be coming onto the second list, third list, fourth list, fifth list. And then you try and say, how much time do I have before, look, with COVID, the good thing that we know is that what is the doubling rate, the cyclical rate of COVID, that rests between 65 to 80 days, right? So if you look at Mumbai, Maharashtra, the last set of people who were coming onto the top of the list were somewhere in the middle of December of last year. That means the doubling rate is going to be somewhere between, it will come to an end around the end of February, beginning of March, somewhere there, or middle of March. You've got time until then. Whether or not the second wave or the third wave, whatever you want to call it, whether that starts after that is something that we will see only at that time. So you've got time to prepare for giving vaccine to the most vulnerable population until that time. And so you'll need to stagger what are the resources that you have, what are the options and choices that you have, and who are the people who need the vaccine the most in the first place. So I think that rather than look at how much time it's going to take, we should probably see that this is the time in which we have to finish the job that we have on our hand and simply employ that many number of people to meet that target as soon as possible.
But Dr. Srivastav, till now, the 4 days have happened, and the experience says that states like Tamil Nadu, Karnataka, even yesterday in Mumbai, the centers were empty. The healthcare workers, hardly 20 to 25% are taking the vaccine. When they are not taking vaccine shots, how you expect the general public will come forward? Because in India, our President of India, Vice President of India, and the Prime Minister of India has not taken the vaccine because they wanted that first those who require the vaccine they should take first. And in that case, the doctor said, we will be taking first. Few of the leading doctors have taken, but others are declining. There is a report, media report that Delhi, one of the government hospital resident doctors have written that no, we will not take a biotech vaccine because it's the third phase is not completed. Even yesterday, there was a on the television, it was shown that the JJ hospital ward was totally empty where they were doing the vaccination. So when this is the situation, how we are going to complete the target of 70 crores, or even if we are talking of 70% of 70 crores, which works out to be about, say, 50 crores people, in how many years?
Nah, I don't think I'm going to be even looking at how many years. See, adult vaccination is always going to be a challenge, even with influenza, even with H1N1. When you say to healthcare workers in some of the biggest public hospitals that please take the vaccine, the healthcare worker will ask me, but tell me, sir, what is the chance of a complication of Guillain-Barré syndrome? So you tell them, and they have read about it and come to you. And it is 1 in 1 million. But the question they want to ask you is, sir, how can you ensure that I am not that 1 in 1 million? All right. So it is about mindsets. It's about a lot of reservation with mindsets to say, can you ensure or can you give me some kind of assurance that I am not going to get a complication? Unfortunately, that is not the case. Nobody, no single person can even, volunteer an assurance that no complication will happen. Unfortunately, also with this vaccine, the two people that have died, the one in Moradabad, uh, both had fatal coronary events in the autopsies. Autopsy was done by three independent, team of three independent surgeons, and all three of them came to the same conclusion. But they were all young. The one in Moradabad was in his 40s. The one in Karnataka was in his 50s. This goes against the general publicity of a vaccine like this. That is something this is going to be floating around for a little while. And with the WhatsApp University, I think that is one thing that I would like to shut down for the next 3 months' time where vaccine is concerned. It should be something of a social criminal negligence to spread the word about the vaccine, which may be detrimental to the vaccine. Only people who are authorized to speak on the vaccine or who have some scientific sanctity should be talking about it. That would be my take, only because it is harming the whole process of the vaccination. So what you're saying is relevant, Mr. Goel, but it is a process. You've got to be able to overcome the mindset. You've got to be able to spend time. You've got to be able to talk to people. I have been advocating this to the Maharashtra government that we should get people who are present celebrities, people who've got a say in public spaces, to be able to come forward and say, please take the vaccine. But mindset is something that will, unless we are able to change that, we are going to be finding this kind of resistance all over the place.
Okay, thank you, Dr. Srivastava. Professor Dr. Brahm Prakash, would you like to add anything about this?
Yes, actually, these vaccines has been started in exceptional circumstances. So exceptional circumstances, we have to take exceptional decisions. That is one thing. Another thing is the availability of vaccine. So much of number of availability of vaccine is not there right now. WHO Director General has said yesterday that one country got only 25 doses. The only thing is that hesitancy to the vaccine is from the very beginning. When I was in Australia, there was a group of anti-vaccine. There was an anti-vaccine lobby, you must be knowing. And DPT was not being given to the children if children were having pertussis in this time. At that time, that was in 95, 96, I was there in Australia. As far as this thing is there, we are going very cautiously. That's why 100 number maximum in birth center. See, like AIMS, like Subject Hospital, like RML, like, KEM Hospital. These are huge medical establishment. They can take thousands of cases per day. But we are going very cautiously. That is very right. That is one thing. We are going in a slightly younger age group, and celebrities have also taken first day. The member health, Professor Paul has taken it. Professor Guleria has taken it. Dr. Trehan has taken it. So a lot of celebrities has taken, and they are all fine. So I think initially, what is cautiousness? That is one thing. If I remember, we used to give penicillin to almost every third case in the hospital for every. That was the best possible antibiotic, and it used to have anaphylaxis. Anybody, we used to test it. Anybody had anaphylaxis with it, we used to treat it. That's all. It was a routine. So it will come in a routine. That is one thing. As soon as the vaccine is, even if vaccine is available in the market today, the number will increase tremendously. Suppose it is of whatever cost it is, there are people who will go for it. So this cautiousness, that's very rightly, emergency use, this emergency permission has been given. So I think this can be covered within 1 year or so if it is opened up.
Okay, thank you, Dr. Prakash. Although 1 year is too short time, we are talking of 70 crores, and right now it's about 1 lakh, or as Dr. Srivastava said, even 5 lakhs if we will do per day, it works out to be very less. To cover 70 crores, we require lots of efforts.
I think 70 crore may not be required, because
Even 50 crores, if we will go for 50 crores also, it's not that easy. Okay, thank you very much, Dr. Prakash. And those who are below 18, they may be above 18. Those breastfeeding mothers may also come out of the ambit, and those pregnant women also be come out of the ambit. So the figure will remain like that. Anyway, thank you very much, Dr. Jain. Would you like to add anything in this?
Yes, sir. I think this question has two parts. One part is, do we have enough vaccine to vaccinate everyone? The kind of numbers you have shown, Mr. Goel, is around 50 crores people. My question here would be, do we really need to vaccinate 50 crore people? So I think our objective here is we are not kind of eradicating the virus the way we did for polio or maybe smallpox long ago. Here, our objective here is to control the pandemic. At this point, if we inoculate everyone who is potentially at risk, number two, if we can inoculate everyone who is potentially at risk of a very severe disease where this maybe kind of get a fatal outcome, I think at this point, this is the only objective. What you are forgetting, Mr. Goel, in your numbers is the people who have already been immunized by the natural course of pandemic. So around, I think October, when the Sero survey was done, around 30% population was already having antibodies. So 30% people were already immunized. And by now, I believe it will be almost 50%. To control a pandemic, what we have to achieve is immunization of 70% population, and then we say that pandemic will control. So the gap is only the 20% population here. It's not that many people who need to be immunized at this point. The numbers you have shown, I was doing a calculation on my computer. For one single dose, it might take about 18 years to achieve that. So this is not what we are looking at. After 18 years, probably we'll be thinking about eradicating corona from the earth. So there is an objective which we have to see, the number of people who require the vaccine. Moreover, as Dr. Brahm Prakash said, that once it will be in the public, from the public domain, it will be going to the private practitioners. It will be freely available. I think people who need it will be taken. One very nice point which Dr. Om Srivastava has mentioned, if you go to the medical people in medical fraternity and ask them to take a vaccine or a treatment, they'll be the last people who will accept it. So he very rightly mentioned, we buy the influenza vaccine everywhere for healthcare, every year for healthcare people. I think barely 10% come forward and take the vaccine. So I think the medical people have the highest resistance, and we have to understand why, as he said, because we know 1 out of 1 million get Guillain-Barré syndrome, which general people may not be aware. And our fear is that, what if I am one of those millions? So there is a kind of more knowledge and more, like we get more sensitive about those things. And so that is a very important point. The second point
Yes, please.
How safe is the vaccine? As of now, like a lot of country vaccination have started. It's safe. Which you tell me that if you give injections to 100,000 people, 1 lakh, 5 lakh, 10 lakh, one of them may die of something very unrelated cause of death. So these kind of things should not come in the public, and that can only be stopped if we limit, if we allow only the people who have the knowledge about the vaccine to talk on public forum. Not everyone should be allowed to talk about them.
Okay.
I think there has to be a restriction on it.
See, Dr. Jain, you have made 2-3 points. First point, you said there was a zero survey. Yes. But who is going to decide? Suppose I will go to a doctor for vaccination, or my turn comes. How the vaccination center will come to know that I am antibodies already there? Who will come?
Never mind.
So
there
it
will
means
not be many.
so that is why so it means I have to take the vaccination. If I have to take the vaccination, then 50 crore figure will be remain. Either we should go, no, I am just asking, either we must go for an antibody test first, and then we will decide who is supposed to take or not.
Our resources may not allow that at this point.
Okay, thank you, doctor.
Our resources may not allow, but ideally, if you look at, we really do not have to inoculate 50 crores of people. The number is much smaller. And to get that 70% break point where we say that the pandemic is under control will be achieved within maybe 1 year or maybe 10 months or something like that.
Okay, thank you. Thank you very much.
That's what my point here is.
Thank you. Dr. Rathi, what you say about this?
Yeah, after hearing all discussion, whatever I have read and whatever I know and whatever I have seen across the world, you require 70% of your population to get vaccinated to develop a herd immunity. Okay, so that is what herd immunity was, a big concept. So we are talking about herd immunity, not because of disease, but because of vaccination. One thing. Second is like Madam was saying, you might not require everyone to get vaccinated. Probably there will be a lot of subclinical infection which is going. Probably we have reported 1.5, 1 lakh, 1 crore, 5 lakh patient. Probably there might be 2, 3, 4 crore patients who are already been, suffering from COVID and has been not tested or has been not been into the hospital. Number 2. Number 3, now probably from March onwards, we'll get another, the Gamela will be available to us. Probably from May, June, there will be a nasal shot which will be available to us. Probably from April, May, there will be a shift of vaccination from public domain to private domain. So in all and all, we'll be having, so your doses will not be a problem. Your availability will not be a problem. So probably we might be vaccinating probably 10 to 15 lakh per day. And probably we can finish. That is what is the model is. And that is what I have heard from ICMR, and I have gone through their Minister of Health Welfare data. Probably by end of December, we will be able to vaccinate the number of people we want to vaccinate to get that pandemic under control. Look, we want to decrease mortality. So it is not about, it is not about your choices. It is about thinking in public as a large. Secondly, as I agree with Dr. Srivastav sir and all of us, we as a healthcare worker should be the front runner to take vaccine, to say to the people and to the community at large, look, we were at the brunt of the, this pandemic and we have taken the shot. It is absolutely safe. So are the celebrities and all other people whom people follows. And they should post everything which is positive about vaccine rather than, quoting that, a couple of people have died or whatever. They just see the word death. They don't understand by what means that death has been occurred. It might be some other comorbidity, but they attribute everything to vaccine. And probably that will give a very bad name. And probably it will make more people to get reluctant. And I think the moment the shift is from public to private sector, the people will start coming more to, because sometimes they believe that, the private sector will be more furnished or more finished to give vaccine rather than public sector. So there are a lot of, very choices amongst the people of India. And yes, after all, it's a mindset. So the more educated you are, probably it's a double way. You can think too much or you don't think any much. So that is how it is. So probably, yes, by end of December, we should be able to vaccinate the number we are targeting.
Okay. Thank you, Dr. Rathi. Dr. Srivastav, everyone is saying vulnerable. Now, till 2 days back, the most vulnerable were 65 plus or 70 plus, those who are having diseases like cancer or tuberculosis or heart problems or diabetes. They were the most vulnerable, and everyone was giving advice that please go and first they will be, and even the government has come out with the figures that those who are below 50 but they have comorbid, they must go for the vaccination. But yesterday early morning at 1:30 or so in the morning, late night, there was a news report which has flashed by Times of India, none other, in which the Bharat Biotech has mentioned very clearly those who are on blood thinner, those who have blood problems, those who are on the other medications should not go for this. Now, there is lots of confusion. Now, as you are saying, WhatsApp University, yes, I also agree that we should not have that. But how earlier vaccination, which Dr. Brahmprakash mentioned about polio and other, at that time, there was no social media. So there was no awareness. Although you mentioned that we should not talk about death, but it is reported everywhere like Norway. Now, Norway deaths are there, whether we admit it or not, and they have put an inquiry, and even the Australia government asked the Norway government to submit their details, whether they should go for that type of a vaccination of Pfizer or not in their country. Now, when this is the situation, don't you think the more and more clear data should come in public domain? Number one, we should, the confusion which is having, that like I am having heart problem. I had 4 years back, I had a massive heart attack and I have put 100% LED was blocked. I am on stent. I was thinking that as early as possible, I will get my vaccination done. I'm not going out from my place for last 10 months. But from yesterday, I was worried. If the company chairman or the company is saying, don't go for the vaccination, whom I should rely, the government or the company or the doctors? Dr. Srivastava, please.
So let me ask you a counter question. Do you know where the largest number of healthcare workers have died? And what is that number? Let me share that with you.
Okay,
it
please.
Is the Amazon.
Sorry?
Right? It is the Amazon, right? And 6,000 healthcare workers have perished there. And I'm talking about only the last about 2 weeks time, 2 or 3 weeks time, maybe somewhere there. Okay, we don't talk about those things that are requiring scientific scrutiny. How have these people died? What was the cause of death in these people? They were all healthcare workers. None of them were affiliates of other industry. All right, now, if you look at the most recent data, that is from, I think, December beginning, the biggest risk for COVID and mortality is none of the things that we spoke about. There are only two. One is a body mass index of more than 29, that means obesity, and two is age. It is not diabetes or hypertension or renal failure or liver cirrhosis, immunodeficiency, malignancy, on being on steroids or any of those things. The highest risk of death is in these two situations. Now, the question that you're asking is very relevant, Mr. Goel, because COVID vasculopathy is a separate entity in itself. What COVID does and what the vaccine does to the blood vessels of the human being is something that we know very little about, even though the collective might of the scientific community is being put into trying to understand that. And every day, at least myself and my team, we tend to read not less than about 30 documents of what may have been generated all over the world with vasculopathy. That means the problems of blood vessels with COVID. In spite of that, I am not afraid to share and admit that my understanding of blood vessels and COVID, and therefore COVID and vaccination also, of blood vessels is something that is still, in its infancy. I know very little, and my feeling is that I will keep learning about this part of COVID and its complications for the next 10 years' time. Already I'm seeing enough of COVID complications now, no longer so much of COVID, but most of complications in my clinical practice. But these are areas that we don't understand a great deal about. So where we are not certain that the benefit is going to outweigh the risk, there is some merit in waiting. Okay, there is some merit in waiting. First principles of medicine is do no harm. So if you are on a blood thinner yourself right now, I'm just talking about your own particular situation. If you're on a blood thinner, you are safe so long as you're not going through an active COVID situation right now. As to whether or not you'll take the vaccine, whether this vaccine is the best or another form of this vaccine or a third variant or the next generation, or maybe something that may not be required for the next 6 months to 1 year, we will know as time goes on. So I wouldn't want to rush in a situation simply because you feel that, because I have a stage, my risk is high. Your risk is now as much or as little as the next person next to you, or as much as the common man. So I wouldn't rush into it. And so I come back to the point I'm making. I am going to be basing my decision only on one thing, scientific data that has been peer reviewed. It's not enough to say that I'm a scientist. It's also not enough to say that I have published it in a journal. I need to have this peer reviewed. Somebody who is a peer should go through it with a fine microscope and tell me that yes, the data that Om Srivastava is publishing is good enough to be standing scientific scrutiny. So that is the data I'm prepared to believe and endorse and speak about in a public platform. The rest of it, the head of a company, it doesn't matter who the head of the company is. If it is not scientific, I'm sorry, I'm not going to either, I'm not even going to read it. Forget about endorsing it. It has to come from a platform where I'm convinced that yes, the science part of this being mentioned is something that has been ratified. Only then will I be speaking about it. So my personal suggestion to you, Mr. Goel, is please don't believe any of these things. It means nothing. Your risk is as minimal as it was yesterday. And if it climbs, I think we will know as to what to do next. So I would wait. That would be my suggestion.
Okay, thank you, Dr. Srivastava. Professor Dr. Brahm Prakash, now when we are talking very openly that some confusion, not some confusion, lots of confusion is there. Doctors or medical fraternity is not coming forward, although they should come forward, as Dr. Srivastava and Dr. Jain has mentioned, you are also mentioning, and Dr. Rathi is also mentioning. But after all, if they are not coming, then how they can preach? It's always like this, that if you want to preach somebody, if you want to tell somebody, then other fellow can ask the same question, have you taken the vaccination or not? I am very happy that today all our panelists says either they have taken or they are going to take. They are no hesitance in this. But why the others are not following? You being the, you have administration knowledge, you are head of the All India Institute of Medical Sciences, Rishikesh. You know more good psyche of the doctors or the medical fraternity. What is the reason why they are not coming forward?
What I have gathered information is that most of the doctors are ready to take the vaccines. Whereas it comes from one government hospital, I think it was from the young doctors, residents, because one rumor or anything can scare them. It becomes almost a mob psychology. And the senior doctors have come up, they have taken. I have got information from AIMS Rishikesh, I am from AIMS New Delhi. The senior doctors have taken it, and people want to take it. Only thing, they are not in priority list or they are not getting access to it. In fact, if I get access today after this program, I will go there. And today I don't know when my number will come. Whenever it will come, I will take it. As far as hesitancy is coming to this, is that this is the vaccine which has come under maximum scrutiny of the public. No vaccine till now has come so much of a scrutiny. If you know the DPT, the simple vaccination in children can give to seizures. So these things are there, but how many people know it? But parents are going to the health centers and taking it.
No, Dr. Prakash, you are right. But at that time, social media or the media was not that much effective when polio and DPT or other BCG, etc. No media were there. So nowadays, everything is in the public form.
Because today everybody is focused on corona and corona vaccine. So the focus is too much there, and one small death, if some surgeon has died in America, 56-year-old of hemorrhage or something, everybody knows it. But earlier, if this corona thing is not there, everybody is not focused on vaccine and the disease, then you will not bother what happened. And now the Pfizer has been given to many lakhs of people, so the data will come, and I think the vaccines by and large all are safe. The only thing is exceptions will always remain. We have lost life with Analgene. You must have remember in your early days when Belargal was there and it is banned, now it has Analgene, and people have died of that also, and people are not knowing why I have died. So the things will evolve, with the data will be coming up. But what I feel still is that vaccine by and large are safe, but they have been approved for emergency use because of the exception circumstances we have to understand.
Okay, thank you, Dr. Brahm Prakash. Now, Dr. Jain, my question to you is, what is the role of non-neutralizing antibodies in post-vaccine COVID enhancement?
Post-COVID enhancement.
What is the role of neutralizing antibodies? Yes.
See, neutralizing antibodies are neutralizing the viruses, right? So they are protective antibodies. Non-neutralizing antibodies may partially neutralize the virus, may not at all neutralize the virus, or rarely though may enhance the infection because it enhances the attachment of the virus to the host cell. The best that antibody dependent enhancement, or ADE as we call it, has been the best studied phenomena in dengue infection. So in dengue we have seen people who have the same infection with dengue with a different serotype. Second time they have these neutralizing antibodies which were neutralizing for one serotype work as a non-neutralizing antibodies for this particular strain, and then the person may have more severe infection. This has just been speculated in actually COVID. We do not know, we have not studied it. And actually, those people who had the second infection with COVID, there are very few instances which have been documented, literally having the second infection with the COVID. They have not shown more severe infection necessarily. So some of them have more severe infection, some of them do not have more severe infection. So attributing all this to non-neutralizing antibodies and then saying that vaccine may produce some non-neutralizing antibodies which may cause more severe infection if you get the infection, I think that's too premature. And at this point, when there are already that many questions regarding the safety of the vaccine, this is not the appropriate time. This will be really half cooked. I think the scientific fraternity has already thought about it. They have looked into the non-neutralizing antibodies, and we are not only focusing on antibodies when it comes to immunity. We are also looking at T cells. We are also looking at other means of immunity by which we are doing it, focusing mainly on T cells. So it's not only antibodies, number one, which impart immunity to a vaccinated individual. Number two, what we are focusing on currently are the S gene, which will be giving us the neutralizing antibodies. Number three, there is only one serotype of this virus known. Not like dengue, there are not so many serotypes of this virus which are known. Number four, whatever ADE we thought about was actually not being demonstrated in practice yet. Number fourth, this is just a speculation. We are not very sure about it. So I think it's too premature, and that will
yeah, Dr. Jain, earlier also you have told that my question is premature, but it's on effect. But I do not want to discuss further because Dr. Srivastava, you all, and I also agree that we should not create panic in the public eye. But it has happened in few of the cases in UK, reported, and the doctors have diagnosed that it has enhanced the infection. But anyway, we will not discuss.
But there are larger number which had milder infection. What about that? So I think we have to look at a balance. We cannot focus on what we want to see. It's a human nature. Like we want to see what is bad happening, what is good happening. That's a very big chunk. I think we should look at that and promote that.
I understand the question comes again back that whether what Dr. Srivastava said, whether I am in that 1 million or not, how I know. Anyway, now I'm coming to Dr. Rathi. Dr. Rathi, if Covaxin was approved after phase 3 trial, would that have improved your confidence? Your means the public confidence in vaccine efficacy. Public means the medical fraternity. I'm not talking of public. Right now, public is not taking the vaccine. Only the medical fraternity, more confidence to them. If they would have approved after phase 3 trial, which they would have finished by now or by, say, another 15 or 20 days. What do you say about that?
Look, I think phase 3 is already over. It is only that the data is not available for public to review. So phase 3 is already over. What I've learned. So it doesn't matter because the platform for both vaccines are more or less same, and whatever data for phase 2 and probably phase 3, what we have got the access of that phase 3, not all the people. So it looks same, exactly same. So what we are trying to say is that yes, confidence will be more for people who are more data savvy or who just want something have their legally or whatever they want to call it. But yes, I think the data for Covaxin as well as Covishield or serum is absolutely same. It doesn't matter which one of the vaccine is this. Covaxin is absolutely safe data. Probably, as Dr. Srivastava also told, he has taken Covaxin, and because an indigenous product, probably we are more harped toward that, and probably that the people who were tested were all probably by Indian for Indian. So probably we will give a little more confidence to the people who are administrating it. So yes, phase 3 data is almost probably another couple of weeks. You will get all the data, and it is exactly same what we are talking about, same Covishield and Covaxin. So yes, probably. And one more point of what I want to harp of whatever discussion we have done. Probably you will see after 3 weeks or probably after a month, the vaccination rate or the confidence of the people getting vaccination will be too much. Right now, people are just waiting and watching for the first lot to get vaccinated and see what happens to them in a couple of weeks of time. So probably after 2 weeks, say end of January or first week of February, you will see more enthusiasm, more people turning out. Probably it will be a big drive after February, because that time there will be a lot of confidence in the community by seeing the previous one who are getting vaccinated.
Okay, thank you. Let's hope for the best for this. Now, I would like to ask Dr. Srivastava, do you think vaccination compliance would have been better if government had followed UK model of starting with higher age group healthcare workers first? We see many young healthcare workers receiving it, while many senior nurses, doctors, etc. have not been called. And in UK, like you have seen that first they have gone for the those old age homes. Although in India, we don't have that type of concept in that much prevailing, but still where the 90 plus, then 85 plus, 80 plus, and like that. But here, first it is going for the medical fraternity. Fine, but medical fraternity also, there is no priority to the senior, and then it should come like that. Do you think it would have been better?
I will have to say I don't think so. I'll have to say that because I think that well, it's a complex question. Number of things come into play, especially with uh, the kind of responses that a 90-year-old will have as compared to say a 50-year-old. Whether or not he is or she is a healthcare worker. Of course, I would probably be inclined to say no, but that is based more on the fact that what I have seen with COVID in the last about 10 months, 1 year's time. People who are in an age group that is over about, say, 70, 75 years, their responses as compared to people who are younger are very different. So I would think that I would probably persist with this policy of the government. But again, look, this is too, any policy, any good policy should be able to have the ability to correct itself, right? Once you've written a policy, if it doesn't appear to be working, the person writing the policy should be able to sit down and say, okay, look, I probably didn't see this part of the policy correctly, and I'm going to modify it. So it may happen that if we have given it to the next, 10 lakh people, 20 lakh people in India, it may happen that we find that the most vulnerable, the elderly, may have been left out, and that they can be incorporated in the next round of vaccinations within, say, maybe a month's time. But as of now, I would like to see more data. For the time being, I think that the policy that the government has written is appropriate. But I'm open to seeing what kind of results we are going to get with this policy writing and this lot of vaccinations.
Okay. Thank you, Dr. Srivastava. Dr. Brahm Prakash, my question to you is, if vaccination continues at slow pace, let's hope that it should not, but if, do you think government is likely to force people or make it compulsory?
I think the vaccination accessibility at this time is very less. Accessibility, because it has been opened only for healthcare workers, sanitation staff, ward boys, nurses, and all that stratified in the hospitals. As soon as it is open and vaccine is available in plenty, the vaccination will improve dramatically. The only, as far as we think that the hesitancy is there, actually hesitancy is there because younger age group like sanitation staff, like ward boys, like nurses, they have been working there in an environment and they are not very much afraid of this corona thing. Corona people are more afraid who are sitting in the house for, they have been forced to, they're almost forced to sit in the house for 8 months or 10 months or no. That phobia is existing in them more. So I think vaccination will definitely improve when it is opened up on the public platform.
So according to you, it will not be going like the family planning thing which we have seen in
No,
our
I
earlier
don't think
times.
you have to force. Today, if you open it, I will also go immediately. I'm not in the priority. I'm in the priority age by 65. Okay, but I don't have access to it now because I'm not with the hospital now. So as soon as people will get it, they will get it. And as far as third trial of Covaxin or anything is there now, so many lakhs of people has taken it, and within 14 days or 20 days, this data will come. And even if third trial would have been finished, it would have been 25,000, 26,000, 30,000 maximum. Now it is in the lakhs. So data will be very much available, and I think people will have confidence. And government policy makers are taking it very cautiously, playing safe also, because in healthcare workers also they are going for the younger people first. So they are going cautiously. Otherwise, some elderly person, some 80-year-old or 80-year-old doctor, eminent person would have died. So it will have a very very negative effect on the program. I think the policymakers have really make a good decision, and I don't find any reason that a vaccination will not increase.
Okay, thank you, Dr. Prakash. Dr. Jain, now my question to you is that what we have seen out of these 9 vaccines which have been approved till now, there are 3 types of vaccine format. One is where they are giving the influenza virus in a very mild way. That is the Oxford one, which if correct, you correct me if I am wrong. The second
adenovirus, that's adenovirus. That's adenovirus.
Yes. And the second one in the like Bharat Biotech is the dead virus. And the third one is an mRNA where that is a different. Now, among the 3, if you have to compare, if you have to choose, because right now, yes, there is no choice whatsoever is coming fine. But after, as all of you are saying that it's going to come in the public domain. Now, it means public, if it will be in the private sector, if I have to go and choose, I have to choose and I have a choice to go for any vaccine. Which one you will suggest and why?
See, it'll be individual choice. When we talk about the vaccine, which is that ICMR and Bharat Biotech vaccine, there are pros and cons with everything. This is a dead virus. See, so virus does not go and multiply in your body. We are just giving the enough antigen dose in an injectable form to your system where the antibodies will be produced and all. The disadvantage here is that you have to have a very big load of the virus because virus is not multiplying itself inside your body. And you might be needing more boosters because there will be less residual effect once this virus particles are degraded. You have to give the new booster and new booster. So the more boosters may be required. But the advantage is that it will not harm you in any way because the virus is not multiplying in your body. The other one, which is the adenovirus one, the Covishield, which is coming to us through the Serum Institute, is actually, there is a virus, which is an adenovirus, which is non-pathogenic. And this virus has a spike protein part of the genome of the coronavirus, which has been integrated inside. So we are giving some copies of this virus, and this virus is multiplying in your body. So more copies are being produced, and then your body is getting exposed to our interest is in that S gene, and more copies of this is being formed. So here you may require fewer booster. Antibody response may be higher. We do not know really. That has to be seen. And boosters also, we do not know. At this point, they're saying 2 boosters will be enough, how long the antibodies last. But when we give the booster in this situation, antibody response will be quicker, definitely, because here there is a live component in the virus, which is multiplying itself. The third, which you are talking about, are the messenger RNA vaccines, which is coming from Moderna and Pfizer, and probably India may have some Pfizer vaccine by end of June or sometime. So these vaccines, there we are taking the RNA which is coding this protein. This RNA has been kept in a capsule of a lipid kind of a molecule where it is integrated in our cell, goes inside the cells, and then this RNA start making the protein in our own body. So what we are thinking is that probably here we might have a larger antibody response. However, since this is only messenger RNA, it will create smaller T cell effect, which we call. T cells are very, very important cells because they are the ones which are the memory cells. They remember the insult which has been caused because of any antigenic uh, kind of antigenic priming. So every vaccine has its pros and cons. Every vaccine will, inactivated vaccines have been tried for centuries. We have seen it works. We have seen it causes no damage or very little damage. So they are very, very safe vaccines. Messenger RNA vaccines are newer vaccines. We do not know what will be the kind of complications later on because here we are using the genetic material. However, the adenoviruses vaccines have also been tried. So all three are safer. I think people should think about whom we are going to vaccinate. If it's, let's say, pregnant women, immunocompromised people, I won't like to give them any live virus particles anyway. So probably the dead virus will be better for them. But people who are healthy and who are going to remain that way, I think they can take the live virus particles also. So I think all three are safe. There is no issue about the safety that has been tested also in sufficient number of people. So whatever is available, I think that's a good choice. There's no this thing.
Okay. Okay.
Messenger RNA is a newer technology, has not been tried on a larger mass scale for any vaccine in the past. So that's a newer technology, and let's see how it progresses.
Okay. Okay. Thank you, Dr. Jain. Dr. Rathi, yesterday only 154 people died. In India, every day, on average, about 25 to 30,000 people die, out of which the figure says about 4 to 5,000 from the cardiac problems, about 3,000 by tuberculosis, more than 1,500 for wounds of organs, and only 154 now from COVID. Now, what is the big deal? Why, when we are not talking of other things, we are not dealing for last so many years about the tuberculosis, which is killing 3,000 people every year, every day, sorry. And we are talking about COVID. We have closed down everything. And now India, and you might be seeing everywhere, people are not wearing masks. Now everyone is normal, attending parties, everything is going on. And there were a fear that because of the new year, more and more cases will come. But luckily, we are fortunate. Apart from India, if you see Europe, UK, USA, they are flooded with the patients. But in India, the number of patients are going down. The mortality rate is going down. So why we require vaccine, Dr. Rathi?
Okay, so I think that's a question which is lingering around, and there are a lot of part to that answers. One, we must not forget what we have seen in last 10 months or probably in a year now. So what we have seen, we have, and believe me, it is on the record or whatever. We exactly don't know how much are the deaths. We exactly don't know how much are the cases. What figures are coming out?
Dr. Rathi, I have to stop. How come we say that we don't know? It's all documented figures, government figures.
I do agree, but there are a lot of instances which happens that sometimes you just have that borderline cases we don't report, and probably because in the pandemic you have to attribute a lot of things to the pandemic. So that is something which we need to take. So we have to take this thing with a pinch of salt. Now, coming back to your question, why we require a vaccine now? Because there are only, say, a couple of hundred deaths which are occurring. Yes, we are getting better there. So I think if we are getting better there, this is the right time to hit, because probably we will achieve both things together. Probably we will vaccinate our people also, and probably virus is also getting down from the society. So we'll achieve that number, or probably so-called, the immunity very fast. So this is not that we have got only a 150 deaths, so we should not vaccinate. We should look at the global. We are going to travel. We are going to go out. We are going to have all kind of economies coming back. We are going to want to live the life of 2019. So probably for that reason, to have everything in order, probably you require vaccine. Now you might argue that why we should, why we should not it's better not to take a vaccine and just get probably will not get COVID in a lifetime. Yes, the answer might be yes, but then nobody knows who's going to that lucky person. So probably giving at the circumstances and giving at all other things and coming back to the normalcy of the world, we have to vaccinate everyone so that we are a free floater everywhere in the world, not only in India, but everywhere. So it is in the larger public interest that we have to vaccinate whole of the world, and so is India. So that is my take on, we should vaccinate everyone.
Okay. Thank you, Dr. Rathi. Dr. Srivastava, my question to you is again, among the three types of vaccines, the Oxford type of vaccine, whatsoever the names, other names, or the Bharat Biotech types of vaccine, or the Pfizer types of vaccine, which one is better according to you, and why?
So look, I think there is something to be said about the messenger RNA technology. The messenger RNA mechanism of the working of the immune system. Once you've got something that works on freezing the response of the messenger RNA in your patient system, then you're also going to be freezing the responses to a number of other medical conditions. That include things like neurological disorders, degenerative disorders, autoimmune disorders. All of that are going to get frozen. Is it a good thing or is that a bad thing? We don't know. We don't know as yet. All right, but it is something to be kept in mind. Will it actually impact in a bad way in people with, say, Parkinson's or multiple sclerosis or any of those things? We don't know that either. But it is a brand new technology. It's an exciting technology. Certainly from the point of view of the COVID vaccines, it's something that should be giving us very good results. So that is the one thing. The other vaccines that you have just mentioned, I would like to draw your attention. Do not forget what happened with the dengue vaccine. Okay, it was meant to be a vector vaccine, and that in the number of people that they gave this vaccine to in Southeast Asia, I'm not going to name the country, but there were number of deaths, not just in tens and twenties, but far more than that. And that happened because the vector on which the vaccine was being carried, it changed once it got into the system of the patient. All right, so we've got to be careful about that. New technologies are wonderful, but they've got to be stable. They've got to be in a situation where they will be able to be predictable and be beneficial to the patient. So which one of these is the best? I think we will know only in retrospective data. Once we have given these vaccines to maybe 10 lakh people, we will know in the next year's time as to how these 10 lakh people behave, what their immune systems did. See, when we say how good is the vaccine is efficacious or not, before we find out, when we give somebody an influenza vaccine, you don't find out how they're doing in 2 weeks' time. You find out how they're doing in 1 year's time. All right, in 1 year's time, the patient should be able to say, yes, the number of the infections that I used to have before I had the vaccine, and now that I've had the vaccine, have reduced considerably. So we will know in about a year's time, retrospectively, with the data that comes out of the vaccine that we've given. I think there is reason to be jubilant about the technologies that are evolving for not just for this vaccination, but for a number of other future vaccinations of RNA diseases, the smaller viruses, and the more unstable ones. But I think that, again, data will come out in a year's time. All these vaccines need to be going through the process that we've spoken about a little while ago. Correct repetition is to be applied without a lot of cynicism, and data has to be interpreted in the correct fashion. Only then we will know whether something like this, brand new or not, is working.
So Dr. Srivastava, just counter question. Do you think we have done it just in a hurry? We have given the approval. We should have waited for more data and then we would have given the approval.
So I'm going to answer your question with an idiom when I use for teaching postgraduate students, that infectious diseases has a treatment, but anxiety is incurable. There is no cure for anxiety anywhere in the world. I think that answers your question.
Yeah, yes, definitely. Thank you very much, Dr. Srivastav. Now, my question to you, Dr. Prakash, is that Oxford scientist Dr. Hill has clarified that AstraZeneca has signed an agreement that vaccine will be supplied worldwide at $3 per shot till pandemic ends. And only after that, companies allowed to charge higher amounts from developed world countries. How come Serum Institute is claiming to charge rupees 1,000 per shot after this free thing or whatsoever they have supplied to the government, although neither the pandemic is over nor India is a developed country? Dr. Brahm Prakash, please.
I think the government will be able to tackle this issue because it is a statement, I think, from the owner of the company. So that statement can be there because of his, marketing strategy or something. I think the government of India will definitely able to handle this issue.
Okay, thank you very much.
I want to say one thing more, if I can get time.
Yeah.
Regarding choice of vaccine, the thing is this, there are points like one is safety, another is efficacy, third is availability, and last is accessibility. Safety wise, all vaccine seems to be safe. Like efficacy wise, Moderna and Pfizer goes about 90%, where the AstraZeneca goes about 70%. Bharat Biotech, I'm not sure, but it must be again 60-70%. The Gamaleya is again 75%. So when choosing this, we will go by safety. Safety like Covaxin is killed virus, so it's safe. Adenovirus is safe. mRNA has been given to so many people. It seems to be safe, but of course, this Norway thing has to be solved. Why it has happened, but it has happened in the frail people and very aged people. So then accessibility. I mean, it is available, but it is not accessible. I'm not able to assess this today. So because I don't have any institution with me, it will take some time. So these factors has to be taken. Then the individual thing, like some person is having bypass surgery, he has on anticoagulants, this and that. He has to be, given the vaccine more cautiously. He is more prone to have it. He's more prone to have more complication. So he cannot be just, part of a group of young people, say about 30, 40 years of age. He has to be given more attention. He has to be in a facility where everything can be tackled. That is my.
Okay. Thank you very much. Now, the last question to you, because time is very less. So I'm asking you, Dr. Jain, what message you want to give to the, any suggestion to the government and advice to public? Please unmute.
See, to the public, this is not the time for panic, as we have already been feeling that this is an unprecedented situation. So there'll be unprecedented solutions also. So these vaccines are, I'm so thankful to everyone who worked towards it. I have never seen, and I'm sure none of us have, history has never seen vaccines, that many vaccines in such a short time. I salute all the scientists who have done it. And I think we have to trust them. There is enough data to believe that these vaccines are safe. I would, to the public, I'll say, please do not spread rumors. Talk only what you understand. The things which you do not understand should not be talked. To the government, I think all the policies should be a dynamic document. Anything, if we, in the course of the vaccination, if we realize that there's something which needs to be modified, there should not be any rigidness about it. All these things should be modifiable documents from time to time. The newer versions may come, which are coming. So we have to depend on it. And I'm also very, very surprised. I work in a government setting. I have never seen, never ever, my 40 years I have spent on KGMU, I have never seen the kind of commitment which doctors have shown, the kind of political commitment which we have seen, the kind of public support we have seen. So I think we have to have faith in all the three people, the medical fraternity, the government, and the public. And I think we are moving ahead. We have moved ahead. We'll keep on moving ahead.
Thank you very much, Dr. Jain. Very last time, Dr. Rathi, your message to the public or any suggestion to the government. 1 minute, please.
I think everyone has nailed it. Probably we should be the medical fraternity should come forward and give the positive message about the vaccine. So is the government; they are doing their best. But I urge public to just don't go by rumors, just don't go by half knowledge, just don't go by something which is on the WhatsApp or something which is in the social media. And I think media is a very important part in this country to actually motivate the common people to be more positive about this vaccination. And probably all of us, once we join hand, will be able to tackle this disease in a better way. We are doing it a very good way, but yes, we will vaccine.
Okay.
Now our vaccination is our main aim, and
Okay.
probably with all these three faculty coming together, we'll be able to achieve the target what we have set for us.
Okay. Thank you very much. Dr. Srivastava, any message you want to give? Last message?
Well, just simply this much, you know, there is some merit in patience, there is some merit in waiting, there is some merit in understanding a situation before you commit yourself to a response. There is really no place for either anxiety or for misinformation. People should be careful about what they're saying because this is a vulnerable time, you know, not just for the common public, but for a lot of people. It's a time that have in the last 10 months, all of us who have been seeing patients will agree that I have not seen the kind of responses that I have in the last 10 months. I've not seen it in the last 10, 12 years since I've come back to India. There's a
Okay.
vulnerable time. There's a time not to play upon the anxieties of people,
Okay.
but to actually allay them, to reassure them that things will work out. Things will definitely work out. Give it the time. It's a
Okay.
process and it'll be fine.
Thank you. Thank you very much. Dr. Prakash, very,
Very small.
yeah.
There are a lot of doctors who are very senior, no more attached with any big institution. They pause their clinical work, patient care work because of this corona. When Professor Pandey, we lost from AIMS,
Yeah.
the government should take list or somehow contact them so that they are desperate to give patient care again. They should prioritize for the vaccination.
Okay. Okay. Thank you very much. So today you have seen that all the top experts, doctors from the different parts of the country advocated very, very forcibly that everyone should go for vaccine. We must not see what's happening in the media, which are giving false informations. Please go get if your turn is there, get yourself vaccinated. If you are a medical fraternity, if you are a government front person who is supposed to get the vaccine, you are in the list. Please take the vaccine. Please become the role model for others. Because vaccine, as per the expert advice, is very, very safe. There is no problem in the vaccine. One must take the vaccine. Any vaccine, whichsoever is available, please take it. Don't ask or try to question, because it's not only for your safety, it's for the safety of your family, for the entire community, for the entire nation. So please do not compare the vaccines, although our program is best vaccine for the COVID, but the result is all the vaccines are good. After done lots of research, they have come out and the government has trying their best. So we must, all the civil society should cooperate by giving the full support for this vaccination program. Thank you very much, everyone. Thank you. And today's program, which has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon se Samvad Sarokar News, as well as it was shown live on Facebook and YouTube. And our endeavor is every day to come out with a new topic. And the tomorrow topic is media conference with Lal Goel, role of youth in education. And our chief guest is Professor Dr. K. Shankaran, Director, Justice K.S. Hegde Institute of Management, NITTE, along with 6 youth leaders who are going to discuss about the role of youth in education. So please tune in tomorrow conference with Lal Goel at 10:30 a.m. Thank you very much, Dr. Om Srivastava. Thank you very much, Professor Dr. Brahm Prakash. Thank you. Thank you very much, Dr. Amita Jain. Thank you very much, Dr. Kapil Rathi, for joining us. And thank you all the viewers for joining and listening the enlightening views of the medical experts. And I'm sure that every one of you would like to get vaccination as early as possible whenever your term comes. Thank you very much. Thanks a lot.